Good morning, everyone. This is Adam Bianchi at the ACMA. I'm a brand director and pleased to welcome you this morning. We have a great session. Dr. Su Zhao will be discussing the experiences that his team and his company and the wider medical affairs community have had during the COVID pandemic. As you know, China was the first country to have to respond to and tackle the COVID challenge, and they have lessons learned that we can all benefit from, and we're very excited to have Dr. Zhao here with us this morning. Before we begin our main part of our webinar, I wanted to get an update from Christine Magala, who is Director of Professional Education and Training at the ACMA. Christine, do you want to talk to us about the COVID task force?
Yes, absolutely. Thank you, Adam. Thank you, everyone, for joining us. And we hope that you and your families are remaining safe and healthy. At a time like this, when our colleagues need us the most, we have put together a few initiatives to not only help keep us connected with the medical affairs community, but connecting the medical affairs community with each other. So the ACMA has convened a COVID-19 task force, which is made up of leaders from industry, academia, and medicine. And we put together a COVID-19 resource page, which we update on a daily basis to bring you the most up-to-date information about the pandemic. We also are offering a free COVID-19 course that is available on the COVID-19 resource page, and that's available to everyone as an additional resource, and I would definitely encourage you to go and check it out. We also know that financial hardship can be challenging now for many. We don't want that to be a barrier for becoming board certified in medical affairs. So we are providing financial assistance and various payment plan options to help individuals who want to pursue the board certification. So please email us if you'd like to inquire about these options. We are also very excited to announce that for leaders at pharma, biotech, or medical device companies who want to board certify their MSLs or medical affairs teams during the pandemic, the ACMA will actually take a portion of the proceeds, and we are donating it to hospitals and healthcare workers that are really struggling right now to help and provide them with the much needed resources that they need while fighting the virus on the front line. And with people being out of work right now, many don't know where their next meal is going to be coming from. So we are currently raising money to donate to food banks and pantries that are quickly becoming depleted in the most devastated areas. So if anyone has any questions about any of our initiatives or programs, please feel free to reach out to us. We know these are extremely tough times, and we want to remind everyone that we are here and ready to support you in any way that we can. With that, I'll turn it back over to you, Adam.
Thanks, Christine, very much. Again, if you are interested in getting involved with the ACMA's COVID-19 response activities, please let us know. We're happy to be a conduit for work that benefits those who are struggling through the pandemic. I now have the pleasure of introducing Dr. Su Zhao. Dr. Zhao is head of medical at Ipsen, China. He brings over 12 years of experience in international pharma companies. He has led teams in medical affairs, including MSL teams, clinical development, clinical operations, health education, medical information, and patient safety. His clinical practice focuses on urology, and he has done advanced work at the University of Sydney and the Health Science Center at Peking University. And with that, I will welcome Dr. Zhao. Thank you for being with us this morning.
Okay, so thank you, Adam. So good morning, good afternoon, and good evening, everyone. Glad to meet you here virtually in ACMA webinar. So my name is Zhou Su, as Adam just introduced, and I'm now speaking from Beijing, China. So I'm the head of China Medical Department from Ipsen, which is an international pharmaceutical company with its headquarters in France. So it's my great honor to share with you our experience as medical affairs in China, living and working throughout the several months of COVID-19 pandemic and lockdown. So Adam, could you move on to next slide? Next one, please. Yeah. So before I start, here is the reminder. So my presentation is my opinion only and does not represent the facts, official views, or policy of my organization. So next one, please. So hope my presentation can provide answers to these four topics or questions. So first one, how can we help our staff stay safe from COVID-19? And the second one is how can we continue the medical affairs operations under lockdown and then back to normal? And third, how can we maintain customer-centric and foster innovations under lockdown? And last one is the key learnings from the COVID-19 month. So within all these four topics, as the biggest threats of COVID-19 is the health of people. So the most important thing is to help our staff keep safe. So it's not easy because it's not easy here in China because we have around 800 employees in China located in different cities. So to achieve that goal at the company level, there are three pillars to form the framework, which are setting up task force team and developing rules and operations. So for the task force team, we have COVID-19 Prevention Steering Committee set up in Beijing, which is our headquarters in China. And the prevention working groups set up in each office in different cities. The steering committee worked more on the setting up rules and allocate resources centrally, while the working groups more focused on implementation and information collection and feedback. And also our medical staff participated in the task force teams to provide medical expertise with their previous clinical experience. And for the rules, we had different rules to help staff stay safe, like the employee health information collection procedure. And we have guidance for office reopen and handling of abnormal health status and contingency plan for COVID-19 suspicion and infection. And at operational level, our company provided staff with self-protection tips like how to wear and take off a mask. Actually, not everyone can wear and take off a mask correctly, as well as 7 steps hand washing. Also, we checked employees' health and the potential contact information every day and provided protective supplies, including masks, hand disinfectant, and also provided special allowance to employees in Hubei province, including Wuhan city, which is the epicenter in China. And along with all these three pillars, our company reacted quickly with the unified actions and dynamically adjusted the measures according to the changes of COVID-19 pandemic. Up to date, we only have 1 staff out of the 800 infected by COVID-19 who was living in Wuhan city, and unfortunately, she got infected during the early days of the epidemic during the Chinese New Year holiday. So with that framework, here's the overview of our company's major actions throughout COVID-19 month. The histogram shows the evolvement of COVID-19 in China by the number of cumulative confirmed cases over time. So you can see from late January to February, and then it goes up very quickly. And below the histogram is our major actions over time. So you can say on the left side, on January 23rd, the government announced a lockdown of Wuhan city. And on the same day, our company provided each employee in China with 30 masks for free. And several days later, the masks were temporarily out of stock in China market. And also, January 23rd is the last working day before the Chinese New Year holiday. So all our offices closed by the end of that day. And after that, the next working day should be February 3rd. But due to the quick deterioration of the COVID-19 pandemic, company decided all employees should work from home and started daily tracking of all employees' health and potential COVID-19 contact information. And from February 20th, the curve of the confirmed COVID-19 cases started to become flat in China, which means COVID-19 was coming to under control. So our offices are reopened, but only for reported enter from February 24th, only for those individual employees who with necessary needs and he or she should report to COVID-19 task force teams one day before entering the office. And after that, as COVID-19 curve was stable, offices were reopened and employees came back to office gradually. First, 2 to 3 days per week office space. So which means employees can decide which day he or she wants to go to office, but the task force team controls the total number of employees enter each office every day. At that time, the limitation was no more than 50% of the capacity of each office. And then 4 days per week office space, and from March 30th, office were fully reopened and we were back to normal, but it's the new normal. And 1 week before that, MSLs were allowed to visit hospitals with permissions from the hospital, the doctor, as well as from our company. Actually, during the home-based weeks back in February, our MSLs had already conducted e-visits with doctors, which I will introduce later. Next slide, please. So the past several months can be divided into 3 stages. Before February 24th is the home base. After that, office reopen, and from March 30th is the new normal. According to our experience, office reopen is of the highest risk among the 3 stages, as people came back into social contact again. And I know that many countries have recently reopened and will reopen soon, so I will introduce this part first. Next slide, please. So before reopen the office, rules and procedures should be ready. General rules include daily information connection, temperature taken, and handling of abnormal health status. The information connected includes temperature and any suspected symptom for COVID-19 like fever, coughing, also potential COVID-19 contact, and the travel information like if you travel out of the city, you leave, and last if you enter office or not. And for temperatures were taken 3 times per day. First should be taken 3 times per day, first at home, then before entering office, and last at 2 p.m. for recheck. And in case any employee has abnormal health status, it should be reported immediately and he or she should go to see a doctor. And if needed, self-isolation and the reporting close contact should also be done. And next slide, please. And another important preparation for office reopen is the protective supplies, including masks, hand disinfectant, temperature gauge, medicinal alcohol and disinfectant, as well as disposal gloves, and the special waste bag and cans. Next slide, please. And the guidance in office will also set up, like wearing mask, keeping physical distance, and maintaining air ventilation, but not using air conditioning. Separated garbage cans for contaminated trashes, and office disinfection twice per day. Next slide, please. So with all these measures, when our office reopened, things were in order. So we get disinfected our hands before entering office. We took temperatures when enter office and at 2 p.m. We washed our hands frequently, wiped our mobile phone with medicinal alcohol, and some of our seats in the office were blocked to make physical distance more than 1 meter. And useful information is posted on the wall, so including the guidance in office, COVID-19 prevention group information, contact information, and protection tips. Next slide, please. But however, the office is not the only place for the risk of COVID-19 infection. Before we entering into the office, there is risk when entering into the office building. So the picture on the left side shows the lobby of our office building. So you can see way in and way out were separated. And there is a infrared temperature checking system in front of the front desk. And the people need the authorized green code to enter into the building. And for outsiders, you can see at the front desk, an outsider was registered. And you can see that staff is disinfecting the public area with the disinfectant. And besides the lobby, elevator is another risk place for social contact. On the right side, you can see two pictures. So you can see the picture is like there's a limitation of the number of passengers, less than 4 per elevator, and they should stand in the 4 corners of the elevator. You can see the footprint on each corner of the elevator. And also the buttons in elevators were covered with replaceable plastic films. All these films got disinfection every hour in daytime. And my personal experience for taking elevator is to take a clickable pen to press the elevator buttons instead of using my own finger to avoid any unnecessary touch. Next slide, please. And also, I want to quickly show the protective measures during our home-based period. So here shows the picture of a community. So again, and you can see this way in and way out separated. And on the left side of the picture, you can see a car driving out of the community, which indicates the preferred ways of getting around, including driving, cycling, and walking. But we preferred less taxi or public transportation. And in the middle part of the picture, on the red banner, it shows the 4 advices to stay safe from COVID-19 from our government. First is wear a mask. Second is wash hands frequently, and then more external ventilation. And last one is less gathering. And on the right side, at the entrance of the community, guard or volunteers, they took people's temperature and checked gate pass and register if he or she is an outsider. And also for residents inside the community, they also received suggestions to avoid going out, wearing mask when going out, and washing hands when back home and more frequently. They also took off outwear and changed shoes when back home into their own home. Next slide, please. So all these protections helped us stay safe, and then we can continue our medical affairs operations under lockdown and then back to normal. So I will move on to the operations, medical affairs operations part. So there's no doubt that medical affairs operations were impacted by COVID-19 and the lockdown. I use this diagram of DKSS model to show the impacts on different medical activities. DKSS model describe the four major parts of medical affairs activities, which are data, refers to data-related activities, including data generation, data translation, and data communication. And then know means identify the data gap by knowing what data we have and what customers need. And then support other functions. And last, supervision, medical supervision and compliance. So within all these activities, the right ones means there's big impact of the COVID-19. For example, the clinical operation, especially the new patient recruitment, the follow-up and the treatment in hospital were largely impacted by the COVID-19 lockdown. And the yellow ones means there was some impact, including the data translation, external communication with the HCPs, and no customer needs, because interpersonal communication is needed and important for these activities. And there are some other activities that there's almost no impact, which are clinical study design, analysis, and study reports. So it's we can do it at home or in office. The internal training, know what data we have, and support and medical supervision. Actually, some of these activities were even strengthened during lockdown, like internal training. I will talk about it later. Next slide, please. So to mitigate the impact of lockdown, communications and documentation activities were moving from offline interpersonal to online digital approaches. So you can see here from this table very clear that the changes to continue medical affairs operations from the offline interpersonal to online digital approaches. Next slide, please. So digital played a big role during lockdown for medical affairs operation. So here I list some digital platform we used frequently during lockdown. I believe all of you are familiar with Outlook for email and Skype for instant communication. And the three below are digital conference platforms for virtual meetings, including BizConf Video Pro, which is called BVC, and BlueJeans and Microsoft Teams. And also the popular WeChat app in China on the right side, which is very powerful. It can be used to send messages, make a voice call and video call, hold teleconference, transfer files, including like pictures and videos, and scan QR code, as well as receive news, etc. So actually in China, the first thing we do after wake up every morning is checking WeChat. And then the last thing before going to sleep is also checking WeChat. So it's quite popular in China. And our MSLs used it as the one-to-one communication tool for e-visiting with healthcare professionals under lockdown. Next one, please. So now, actually in China, we are back to normal. Next slide, please. So actually, we're back to normal, but there's the new normal comparing to before. So although we are fully back to office to work, but we have to wear a mask. We have to wash hands frequently, and we have to take temperatures 2 to 3 times per day, and we're tracked on our health status. And plus, live with a more digital life. So next one, please. So in addition to the continuity of the operations, we also wondered how we can be creative and customer-centric for innovations on the lockdown. So I will move on to this part. Next slide, please. So the method is quite simple. So first, understand customers' needs and then brainstorming and run pilot projects and assess the results. If it's good, continue, and also continuously improve our project by understanding the dynamic change of the customer's needs. Next one, please. So we take healthcare professionals as an example. Back to this COVID-19 diagram again. So take HCPs as an example. We identified their needs through MSL calls at the beginning of the pandemic and then continues. And we found that in February, as the COVID-19 curve was going up, HCP's top needs were self-protection, knowledge, and protective supplies against COVID-19, and followed by psychological counseling and sympathy, as well as they are under big pressure. While his or her own specialty needs came behind. And then when the COVID-19 became flat in the second stage in March, their own specialty returned to top interest as well as patient management under lockdown. Next slide, please. So based on all these insights and information we collected, we consider COVID-19 topics as HCP's focus in February, but topics of their own specialty as their topic in March and April. So their needs are changing. Internal activities to strengthen ourselves in February, because we can do little in February to meet their needs. And then in March and April, we conducted external HCP activities. Next slide, please. So in February, we spent our time on the lockdown for online self-learning with different learning resources. And also we as trainer generated internal medical training materials as well as provided internal medical training through different digital channels and formats to our staff, like organized digital training meetings, sent WeChat training articles, and uploaded educational animations on internet for internal training and learning. Next slide, please. And I also took the opportunity of February to attend and share in webinars held by industry associations in China. For example, CMAC, which is China Medical Affairs Congress. It held around 12 webinars in last 2 to 3 months. And I gave a speech of multi-channel education in their first digital webinar in February. Next slide, please. In addition to this, we used the lockdown period to call for digital innovations from our staff, both at company level and at medical department level. So our medical program, Medical Brain versus COVID-19, received 21 new projects. 10 of them were selected to be carried out, and with results assessed, and 5 of them continued in the new normal. So sorry I can't introduce details but I will show you some types of our digital activities, the common types. Next slide, please. So the first one is the digital meeting for HCP's scientific exchanges. It's a typical one we conducted during lockdown by MSLs. So HCPs will receive invitations of meeting through e-poster, and once they confirm the attendance, they can enter the webcast by simply scan the QR code. And in the plenary session, speakers get presentations with slides, and also they can show their videos of surgery. And then during the discussion session, group discussion can be held. So actually, we found that very interesting. Doctors are more active online than offline. Next slide, please. And another common digital type was live broadcasting. it's a little bit different from the digital meeting because only one speaker gave presentation and the audience can post their questions by typing messages. And in case any audience missed the webinar, replay is allowed. So this is kind of like audience can learn anytime they want. Next slide, please. And besides these forms for exchanges, we also have, next slide, please. We also have single-way educational articles. It's also popular. A previous one. Thank you. So we sent the articles to HCPs through WeChat. So you can see here in February, our articles focused on COVID-19, including disease management under lockdown, as well as how HCPs can protect themselves from COVID-19 in clinical practice. And from March to April, we focus on HCP's own specialty, including the latest updates of international congresses, as well as thought leaders' opinion and comments on latest progress. Next slide, please. So here I summarized our experience and observations of digital under lockdown, because digital boomed under lockdown. So it boomed, and it's definitely the trend for future, but speed matters. So you can see from the diagram here, I drew the diagram by myself, so I just schematic diagram. You can see from the diagram that the needs and supply of digital activities were balanced before the pandemic and lockdown at a certain level, and they will reach another balance sometime after the pandemic, but at a higher level, which will be the new normal, with digital much more popular than it was before. And in between, the supply goes up and down and up the needs, which provide us opportunity window to penetrate. The undersupply phase is the best time to penetrate and win digital battle, as customers have few digital options to select during the period. It's like a blue sea market. And if our digital activities comes later and unfortunately fall into the oversupply phase, it will be much more difficult to win. Actually, now China has already come to the oversupply phase, but I believe some other countries may still be in the undersupply phase, so still opportunities to go digital. And the key successful factors also change by time. During the undersupply period, it's a good and a reliable digital platform is more important. So people like the reliable digital platform. But later, during the oversupply period, because there are more digital platforms supplied than needs, good content is more important than the platform. So the audience, they can pick and select which digital platform and content they want. So next slide, please. So last part is our key learnings in the last several months of COVID-19 and lockdown. Next slide, please. So first, stay safe is fundamental. Otherwise, we can do nothing. And the second, be optimistic in spirit, but also be prepared for the worst. And third, COVID-19 is a historical public health crisis, but we are offered with the opportunity to create history and make innovations, which is digital. Actually, during last several months, in China, telecommuting, online education, and online healthcare have boomed in China. All of them are digital. And that's consistent with our experience in medical affairs field. Digital comes faster with COVID-19. So that's all about my presentation. Next slide, please, and thank you for listening. Also, I put my WeChat code and the LinkedIn account here to keep in touch with you from all around the world. thank you again, and I stop here for questions.
Thank you, Dr. Zhao, very much. So we have a few questions that have come in, and we encourage everybody to continue to submit your questions. We have a attendee who was just asking for kind of the most up-to-date information about confirmed cases, and are they continuing to rise slightly each day?
Yeah, actually now it's kind of, we're worried about the second wave of the COVID-19. So back to China. Actually, in the north part of China, in the south part of China, in Guangzhou City and some northern cities, the reported new cases of COVID-19. But it depends on which city you are staying in. So now the government has identified the high-risk area and also the low-risk area. So we're in close tracking of the evolvement of the COVID-19, and that's why I call this time still new normal. So we still need to wear a mask, and we still need to take our temperature and checking our health status. So it's not, we can't say now it's the end of the COVID-19 pandemic in China, but we hope it can be under control and won't impact our life and work as before.
Understood. And what is the company's strategy in regards to the second wave?
I would say it's quite similar to the strategy for the first wave. So we are closely tracking the dynamic of COVID-19. So in case we found there's, like, for example, increasing cases in Beijing or in other cities, we might close the office again. But it depends on how the situation is. At this moment, so far we don't see such a high risk of COVID-19. Actually, today in Beijing City, the government has relieved the restriction of people from other cities when they arrive in Beijing. Previously, they have to self-isolated for 14 days, but now this isolation policy has been withdrawn. So we see it's coming to the good, going on the good side.
Understood. Okay. We have another question. What is your understanding of the kind of the current state of convalescent plasma therapy for COVID-19?
Actually, I'm not familiar with this therapy, so sorry I can't answer this question.
Understood, and I think it's, I guess, a wider question of what do you see with the current state of both treatments and potential treatment regimens and vaccines in development?
Well, actually, I know in China there are several vaccines under development, and one or two of them, I can't remember, but some of them are going to the clinical studies pretty soon. But still, for me, to my understanding, vaccines still need time to development and prove its efficacy and safety, and before largely used in population. I also know that in America, vaccines are on the way. So I hope we can have a vaccine as soon as possible. But I heard that it's like needs still another 3 months for vaccines to come into use. Actually, I'm not the expert to comment on vaccine because it's not my major.
Right. No, I understand. In regards to MSL activities, just wanted to clarify, and I believe you said this, but we had a question about, so the MSLs are able to actually go to hospitals to see their physician stakeholders?
Yes, they are allowed to go to hospitals to meet their HCPs, and as I just mentioned, this kind of approach needs the approval from the hospital, the doctor, as well as our company. So again, it depends on the area, because for some high risk area, still the hospital is closing, and only for the emergency cases, or all the outpatients are closed. But in some other areas and hospitals, it's like fully reopened. So our MSLs are allowed to enter into the hospital and to meet the doctors. And but still, they need to show the green code. Actually, in China, everyone has a code on their mobile phone. If the code is green, it means that in your last 14 days, you haven't gone to the high risk area, and which indicates that you are in a healthy status and you are safe. So we need the green code to enter into hospitals, enter into communities, enter into office buildings, almost everywhere, and also the shopping mall. So it's like still with some kind of control for people to move around, but we can move around with the green code.
Okay. And somewhat related, what is the new kind of mix, the new balance between in-person communication and digital communication? And how does it compare to how things were, say, 6 months ago?
Definitely the digital contact increased a lot comparing to 6 months ago, comparing to before the pandemic. Actually, as I know, there are a lot of digital platforms in China. They boomed during the pandemic. For example, there's a telecommuting platform named Ding in China, and previously it's like just a social. But during the pandemic, not only the white collar people using it for working, the schools and the teachers, they are using it to conduct online education and training to lesson online education to their students. And for a short period of time, the system got how to say, overloaded, and there's problem there. But after that, actually, there are more digital platforms coming to the market, and to meet the needs of people under the lockdown, because people have like when they stay at home, actually they have they don't have many choice to do. So it's like go onto the internet, or they look at the WeChat and to make phone call with other people. Actually, it's more digital life than before. Actually, in the last 2 to 3 several months, the habit of using digital platforms has been built up for many people. Actually, it's not like they want to form this habit. It's the lockdown forced them to have this habit. So it's quite a common it's quite an agreement in China in the digital field that the COVID-19 benefits the digital penetration into people's life.
Right, right. You mentioned that the areas of high risk are clearly still practicing the most aggressive forms of quarantine. In areas of low risk, is testing still universal or commonplace, or is that something that's really more focused in the high risk areas?
So you mean the test of COVID-19?
Yeah, I'm sorry. Yes.
Or yeah. Actually, for the test, I don't think there is a difference between a low risk area and a high risk area. So it's like for any people, they got the suspected symptom and or contact history. When they were sent to the hospitals, they will be tested for COVID-19. It's quite a universal test, so it's not like limited to some people. Yeah, that's my understanding.
Okay. And how are you conducting kind of medical education and continuing education currently? Is that move strictly into digital, or is there a mix? How are you handling those events?
Actually, now it's I would say it's like fully digital, because it's like there's no face-to-face meeting anymore. Even people speaking to each other, they stand 1 meter away from each other and wear a mask. So all the education here are digital ones, and our medical staff, they organize the meeting also from digital channel or digital approach. So it's like to invite doctors from using digital platforms, and to like when they need to sign any documentation, the e-documentation, and for the education itself, yeah, digital. So we can foresee like in like 2 or 3 months later, the face-to-face activities, meetings or educational programs will come back, but at this moment, still digital activities.
Okay. Have you shifted any MSLs to kind of in headquarters activities, or have you maintained MSL team size throughout?
Oh, so you mean the number of MSLs?
Yes.
Yeah, no, we didn't cut MSL number, because it's like how can I say? Actually, the interactions with HCPs slightly reduced during the pandemic. So, but we didn't reduce any number of MSLs, because during this period of time, it's like I would say it's not so good to fire people or to like lay off employee. It's like we still keep the same team size, and we switch their offline activities to online activities to meet the opportunity, because we can't see the needs, the medical needs from our customers if was changing during the pandemic, but it's not reduced. It's just like from the needs from their own specialty topics to like how to protect themselves and to manage patients during the pandemic. So needs still there. It's just the focus or the priority changes, or the needs, the type of needs or the solutions change from offline to online. So we don't see a strong rationale to reduce the MSLs.
Good, good. You mentioned that you are able to get in to see HCPs at hospitals. Have you, in your in-person activities and calendaring, do you find that your MSLs have shifted to outpatient clinics or smaller doctor offices to perhaps avoid the hospital environment, or is that kind of back to the traditional strategy?
I would say it's like, yeah, actually for outpatient is more the proportion of like outpatient clinics is more than before, or our MSLs are focused on more on this part. Is easier than the in hospital to the world to visit the HCPs. And another interesting thing we observed is like the impact to different department of the hospital is different, because we can see that for example for those pediatrics clinics, it's like they have a bigger impact, and for the gynecology that have a relatively big impact. But for oncology department, the impact is relatively smaller. So it's very interesting, and it's like also the doctors from different departments, they play different roles during the pandemic. For example, for doctors from respiratory department, most of them were sent to Wuhan, to the first line to fight with the COVID-19. But for some other doctors, for example, urologists, most of them still stay in hospital. They are still keep running of their work, but they focus more on the urgency cases, while for those patients or the surgery that can wait, they will let the patients to wait.
Right. Okay. Okay. And along those lines, how has the disruption affected the way that medical affairs works with, say, the commercial function or the sales team?
Actually, more closely than before. So, because as I mentioned before, so it's like because in the whole February, we can't do external activities, so all our staff focus on internal activities, which means we spend a lot of time learning and training. So it's like the whole February is a golden period for internal sales training. Actually, we did training every day for the sales people, and also during this period we have closed more time to have discussions with marketing team and with the commercial side, because it's like we can have the discussion through the teleconference, so there's no big impact. So actually we find that very interesting for this COVID-19 month, the internal communication of the whole company is like increased. So it's like a better cooperation than before. I can't say the results are definitely better than before, but at least we observed that the interaction between different teams, different functions, different departments goes higher than before. So it's like a good time for people inside the company to cooperate.
Okay, wonderful. And I think we have time for just one more question. This one's come in. Has IBSN approached kind of setting policies at a global level, or is it more regional or country by country? How's the internal communication been handled?
You mean the policies for COVID-19?
Yes, I'm sorry, policies for responding to and managing through COVID-19.
Yeah. Actually, it's like a step by step, because China is the first country to face the COVID-19. So we are the first one to react to this virus. And then it's like step by step. Then Europe, and we can say that then the whole the group, we have the more solid policies. But it's not like at the same time we have a unified policy released from global. But it's like first it's like country by country, but it's like it's not after a short period of time. It's like at the global level, there's like they weekly update and the policies released. So I would say it's more depend on the situation of the COVID-19 in each country and worldwide. Depends on the involvement of the pandemic.
All right. Thank you, Dr. Zhao. Thank you very much for being with us today, and thank you for sharing so much valuable information that I think we can all take back and incorporate as we all work through the pandemic and through quarantine and prepare for the new normal. It's been very useful. Thank you for your time.
A great pleasure. Yeah. Thank you. Thank you. And hope we can have a good future for back to normal.
Yes, we are all looking forward to that. Thank you everyone for joining us today. We appreciate your time. If you have further questions, please, you can submit them now through Zoom, or you can send them to us at info@acmainfo.org. That's info@acmainfo.org. Thank you, everyone. Stay safe and be well.